Welcome. Today we're delving into a lung disease called respiratory bronchiolitis-associated interstitial lung disease, or RB-ILD. This condition, primarily linked to smoking, can significantly impact breathing and lung function. Join us as we explore its causes, symptoms, diagnosis, and available treatments. The primary culprit behind RB-ILD is cigarette smoking. Exposure to tobacco smoke triggers inflammation and damage within the small airways of the lungs, specifically the respiratory bronchioles. While it's strongly associated with smoking, it's important to note that not every smoker develops RB-ILD. Genetic predisposition and other environmental factors may also play a role, though these are less well defined. RB-ILD's pathophysiology revolves around inflammation and the accumulation of pigmented macrophages within the respiratory bronchioles. These macrophages filled with inhaled particles from cigarette smoke, cause thickening and scarring of the bronchiolar walls. This, in turn, leads to airflow obstruction and impairs gas exchange in the lungs' alveoli. The inflammation extends beyond the bronchioles, affecting the surrounding lung tissue, causing interstitial inflammation and fibrosis. RB-ILD primarily affects current or former smokers, typically between the ages of 30 and 50. Precise prevalence data is challenging to obtain, as it is often underdiagnosed or misdiagnosed as other lung conditions. However, studies of lung biopsies reveal that RLD is a relatively common finding among smokers with respiratory symptoms. Individuals with RB-ILD often experience a gradual onset of symptoms. Common signs and symptoms include a chronic cough, often dry, and shortness of breath, particularly with exertion. Some may also experience wheezing, fatigue, and chest tightness. The severity of symptoms can vary from mild to significantly disabling, depending on the extent of lung damage. Diagnosing RB-ILD involves a comprehensive approach. A doctor will start with a thorough medical history, focusing on smoking habits and respiratory symptoms. Pulmonary function tests, such as spirometry, can help assess airflow obstruction and lung capacity. High-resolution computed tomography, or RCT, scans of the chest are crucial, often revealing characteristic findings like centrilobular nodules and ground glass opacities. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. While RB-ILD doesn't have distinct subtypes, its presentation and severity can vary. It is important to differentiate RB-ILD from other smoking-related lung diseases like desquamative interstitial pneumonia, DP, which has overlapping features, and from more severe forms of interstitial lung disease. The differentiation is based on clinical presentation, HRCT findings, and histopathology. The cornerstone of RB-ILD treatment is smoking cessation. Quitting smoking can halt the progression of the disease, and in some cases, lead to improvement in symptoms and lung function. Bronchodilators, such as inhalers, can help open up the airways and alleviate symptoms like wheezing. In more severe cases, corticosteroids or other immunosuppressant medications may be considered to reduce inflammation. Pulmonary rehabilitation programs can also be beneficial, helping patients improve their breathing techniques, exercise tolerance, and overall quality of life. Oxygen therapy is indicated in advanced disease when oxygenation becomes significantly impaired. The most effective way to prevent RB-ILD is to avoid smoking altogether. For those who currently smoke, quitting is the single most important step to protect their lung health. Avoiding exposure to secondhand smoke is also crucial. Promoting smoke-free environments and educating individuals about the dangers of smoking are essential public health measures. The prognosis for RB-ILD varies depending on the severity of the disease and the individual's response to treatment. In many cases, smoking cessation leads to stabilization or even improvement in lung function. However, some individuals may experience progressive lung damage and decline in respiratory function. Recent research is focused on identifying biomarkers that can predict disease progression and response to therapy. Further studies are also exploring novel therapeutic targets to address the underlying inflammatory and fibrotic processes in RB-ILD. Early diagnosis and aggressive smoking cessation are key to improving outcomes and preserving lung health.